Hi everyone, my name is Inger Ashing. I'm the CEO of Save the Children International. I'm excited to be here today to officially launch Save the Children's Global Center for Excellence of Innovation. But before I do that, I would like to share a video highlighting our work at Save the Children over the last year. 2020 was a very different and difficult year for all of us. But Save the Children, we managed to come together like never before. To ensure our program delivery and our advocacy, we needed to be creative, innovative, and to amend and adapt our work. Save the Children does whatever it takes, every day and in times of crisis, transforming children's lives and the future we share, to give children a healthy start in life, the opportunity to learn, and protection from harm, as reflected in our 2030 breakthroughs. As the leading expert on children and children's rights, with a footprint in over 120 countries around the world, Save the Children has unparalleled strength as an innovator. Our global staff live and breathe our breakthroughs and our theory of change every day, where they are the innovator, developing evidence-based programs to find solutions to the problems that children are facing. We have a strong legacy of innovation. Save the Children has been grounded on innovation, disruption, and doing whatever it takes for children for as long as we've been around, since our founder, Eglantine Jebb, 100 years ago, created Save the Children. She did declare the rights of children, being a real pioneer and innovator. And the vision, her vision, which was really radical in her days, is still continue to propel us forward. It serves as the foundation for many of the present sustainable goals and has been the cornerstone of our development ever since. So, our Global Center of Excellence for Innovation. In the continuous spirit of doing whatever it takes, we are doubling down on our investment in innovation. Our evolving world, where children, families, and communities are demanding different work, different things, new solutions to the problems that they are facing. Therefore, I'm officially pleased to announce our new Global Center of Excellence for Innovation, which will be based out of our Asia Regional Office in Singapore, and will be the global hub for all our work in Save the Children on innovation. Our vision is for innovation to be the catalyst that drives new ideas that deliver positive impact at scale for children, focused on the intersection of our biggest ambitions and our most pressing problems. Innovation, just to spend a few minutes on what we will do at this Center of Excellence for Innovation. And sharing some of the principles behind our work. And those principles are rooted in the insights that we have gathered from our colleagues across Save the Children, from our partners, and most importantly, from our innovators. They are at the very core of what we will innovate moving forwards. It is about designing for scale and delivering with agility. And that means that we will define scale from the start and make sure that we design and prioritize to achieve impact at scale. We design our innovations to support our 2030 breakthroughs, making sure children survive, learn, and are protected, and to maximize our impact. It is about designing for and with families, children, and the local partners. It's nothing about us without us. it's incredibly important to involve children and the families throughout. We will prioritize innovations focused on protecting the rights of children most impacted by inequality and discrimination. It's also about becoming more data research and evidence led. We align our innovations to our global research, evidence and learning agenda, defining clear metrics for all innovation activities and govern these with rigor. It is about developing a more strategic and proactive approach to partnerships. We know that we alone don't have all the solutions, nor are we aware of all the problems that children and their families are facing. We know that there are other people that have answers that we don't, and that we together with them can find new solutions. And we view partners as a source of ideas, skills, technology, creativity. And it's not just about funding, it's about co-creating and building something stronger in partnership with others. A few words on our innovation accelerator. Current trends indicate a growing divide of the have and have-nots on the global digital transformation. A rapidly deteriorating climate which will increase disparity within and between countries. An emerging focus on localization, new expectations of savvy donors who wants to co-create solutions, and competitions from the private sector, social enterprises, and peers to deliver non-traditional solutions to development and humanitarian problems. And our solution to unleash the most promising innovators to address these challenges is our innovation accelerator. Our ability to not just develop and test innovation solutions, but also dramatically scale what works, allow us to create lasting, systematic change for children. It's only through new innovations that we will be truly able to change the world for children. We already have $3 million for 2021 and are looking for partners to accelerate our innovations for children. We will support innovators, internal and external, to develop their ideas through innovation incubators, where we will build their capacity in human-centered design, storytelling, and business model development. We will provide funding for these innovators to pilot their ideas and to prepare those ideas for scale. Some of the ideas will fail, but we are focusing on smart failure and will make sure that as we take the risk, we learn what works and what doesn't work and share those learnings globally. For us to succeed, of course, it's critical to make sure that we do have a culture of innovation. Innovation is fundamentally about doing something new, which creates values and drives impact. Doing things in a new way requires new behavior and mindsets across the organization. For this to be successful, we really need to focus on creating a pervasive innovation culture. We have developed several promising innovation pilots that you will hear about in a few minutes, but they are truly just scratching on the surface and brain power of our more than 15,000 staff around the world. And we need to create a culture that unleashes that creativity throughout enabling our different behaviors. So I will just briefly say that some of the key behaviors that we see that we are going to focus on is governing for impact, building innovation skills, communicating with purpose, recognizing innovators, and leading by examples. I will now show a short video showing an example from our Save the Children Rwanda country office before we hear more about the case studies from our innovators. And this video shows an example of a program that we do in partnership with Kakaram. We are engaging urban youth refugees in Rwanda with an opportunity to gain access to decent livelihoods through micro work, small pieces of data collection for AI companies completed through their mobile phones. And we are keen to see if this could be a scalable solution to address unemployment among refugee youth in Rwanda. And we hope that this small pilot will help us learn and test the idea. So I'm now showing the video from Rwanda.
Hi everybody, my name is Andy Nilsson. I'm the Director of Campaigning and Advocacy at Save the Children in Myanmar, Sri Lanka and Thailand. I'm also the creator of Shift. The Shift is a campaign accelerator designed around the needs of young activists. It provides young people with the skills, tools, mentorship, networks, and the resources they need to design and implement influential campaigns on issues that matter most to them. We know that this support for young activists is needed because Shift has been designed and tested in partnership with young people themselves. Through Shift-supported campaigns in our pilot year in Myanmar, we've already influenced the Myanmar government to start releasing daily air quality readings to the public for the very first time. We created Yangon's very first plastic-free zone, and we built the confidence of local girls to speak out against sexual harassment in their own communities. Now we are ready to bring Shift to scale across Asia and perhaps even across the world. Our future vision is one where a 15 or a 16-year-old girl or boy living anywhere in Asia can access our digitized co-creation tools and apply for funding and support to have a positive impact on social or environmental issues. We're also utilizing our Shift tools to better integrate child and youth participation into our programmatic approach and address emerging issues like online safety. That includes more engagement with those who actually build technology platforms. Our philosophy with Shift is simple. Young people must be involved in the design of campaigns that are aimed at influencing other young people. And young people wanting to shape the world must have better pathways to organizations like Save the Children in order to be truly empowered. But thanks for this opportunity to introduce Shift to you. I'm now going to hand over to my colleague, Alison, who'll introduce you to Cubic.
Hi, I'm Alison Zelkowitz. I'm the founder and director of the Center for Utilizing Behavioral Insights for Children, also known as Cubic. So we launched Cubic in April 2020 because human behavior and decision-making are core to everything Save the Children does. And we knew that by learning from the behavioral sciences, which primarily behavioral economics, neuroscience, and psychology, we could increase the effectiveness of our programs and have a greater reach and impact for children. So Cubic's mission is therefore to apply behavioral science to create positive change for the world's most marginalized children. So in our first year of operation, we introduced the behavioral insights approach to the broader Save the Children movement, and we specifically focused on working in an in-depth manner with 6 pilot countries in Asia and launching projects with those countries. And for example, in the Philippines, in order to increase positive parental engagement with children 3 to 5 years old and contribute to their literacy and numeracy and social and emotional learning skills, we launched a program called Tips by Text, which is a series of 40 weeks of text messages 3 times a week, which gives parents really concrete things that they can do with their children to help improve their learning. So we're now measuring this via randomized control trial, and we'll have the effects at the end of this year. In our first year, we also really focused on building strategic partnerships, both with universities like INSEAD in Singapore, as well as University of Chicago and Boston University, as well as behavioral science partners like Ideas 42 and the Busara Center for Behavioral Economics. So Save the Children's Innovation Accelerator process was really critical to launching Cubic, as it connected me both with innovation champions and leadership, and it also provided essential seed funding. So I'm so excited to see the Global Center for Excellence in Innovation launching. Now over to you, Mohini.
Thank you, Alison. And hello, everyone. I'm Mohini Venkatesh. I'm an advisor on school health and nutrition at Save the Children. And I'm also the co-founder and team lead for Waliku. And Waliku started out as a pilot innovation project with the accelerator a few years before COVID-19 hit. And over the last 5 years, we've gone from testing an idea of introducing technology in schools for teachers to use for their daily tasks, to taking it from that proof of idea and proof of concept to a pilot, and now we're at the post-pilot phase. So what is Waliku? Waliku is a student absence and well-being management system that creates a digital nest for school communities to support children's learning and success through school years. At Waliku, we provide a suite of technology-based solutions that allow teachers, schools, parents, school districts, and all of the other stakeholders that have a duty, a right towards their children in the community, to identify and respond to the risks that children face. These may be related to their health, as we're seeing with COVID-19, or it could be with relation to their personal, family, and social needs, as we're also seeing during the COVID-19 crisis. It starts with simple tools that make the life and the work of teachers easy, such as digital attendance taking, which then helps them to identify immediately those children, absentees, who are missing out on a lot of school and for specific reasons. And then they can use that information and additional tools and workflows to act on the needs for those children and remediate for it, both at an individual child level or at a group school community level. And all of this happening in close concert with families, with local clinics, child welfare services, community leadership. We started out in Sumba Barat, a local district in Indonesia. We're moving to a second district in Indonesia and are on our journey to taking Waliku to other countries in Southeast Asia and beyond. We're very grateful to ADB for the opportunity they've given us to work with them on creating these links between schools and communities. And that's a partnership that can talk to later.
Thank you so much, Andy, Alison, and Mohini. Now we have a few minutes if there's any questions from the audience. So if you have questions, please share them in the Q&A chat and we will try to address them. So I do have one first question that I would like to ask Andy. And that is, given the current political unrest in Myanmar, how do you expect that this will affect your work?
Yeah, thanks. I'm sure everybody is aware of the crisis in Myanmar, which has happened since the 1st of February. Obviously, it's a very, very difficult time for everybody in Myanmar, and particularly given that young people are at the center of a lot of the protest movement and face the majority of the threats there. In terms of shift, we've always, the number one principle for us at Save the Children is the protection of young people and the protection of children. And obviously another principle that we like to uphold is freedom of expression without fear or consequence of any sort of violence or consequence. Shift is really not looking at the sorts of issues that would be so politically sensitive. We're really building our interventions around some of the emerging issues that young people are already out there working on, such as trying to impact climate action, a lot of issues based on gender rights and sexual rights, and LGBT movement, social rights within Asia as well. So we're really looking at taking on those issues or supporting young people on those issues. And for that reason, it is going to be very difficult to operate in Myanmar under the current context. But as I said before, we're really looking at taking shift across the region, but also across the globe, and focusing our areas on taking shift to scale in that way.
So one more question for you, Andy, and Alison and Mohini. I think this question might be relevant for you as well when I come to you. But we are all very much aware of the digital divide we see in around the world and in many of the countries in the regions. So how do you make sure that you are able to engage the most vulnerable children who do not have the access to technology? Andy, if you go first, and then I can come to Alison and Mohini later.
Yes, yeah, absolutely. When we tested Shift, we made sure that we were working with a very broad range of young people. This is just within the Myanmar context, and so what we've found is that with tweaking of the tools, which are essentially co-creation, human-centered design philosophy, we can make a workshop incredibly relevant for university-educated young people in, say, a major city, right through to we worked with young girls in small rural villages outside of Mandalay. And because the whole project is based around the needs and desires, but also the co-creation involving young people, they can very quickly be modified to make sure that we're actually being able to work with the most vulnerable people as well. And another thing is, as the digital divide is closing, we are seeing much more digital access throughout Asia, and we actually see digital being a part of bridging that divide. So rather than in the future just choosing one or two youth groups to support in these advocacy and campaign projects, we are very ambitious and want to digitize our resources so that any young person who has access to the internet can actually go online and self-guide themselves through some of those really, really important activities. And then every child has an opportunity to actually bring their proposals to us. And we think that's kind of flipping the script on the way that most development organizations are working. I'll hand it over to my colleagues if they want to address the same question.
Yeah, I think from the behavioral perspective, one thing we learned is we really need to reach people through the means that they are most comfortable in collaborating and working with us. So really making sure that we do a very thorough research at the beginning to see what that is. And that's why, for example, in the Philippines, we decided to go with traditional text messages because that was the most popular way to reach particularly vulnerable parents. On the other hand, for a project we're leading in Indonesia, we've created a WhatsApp chatbot because WhatsApp is so popular in Indonesia throughout the country. But there may be other contexts where we actually have to reach people face-to-face through community meetings in schools, but really going to them with the technology or communication system that they're most likely to actually use.
Yeah, and a follow-up question for you, Alison, and then Mohini, I will come to you. But so I mean, how can we teach children social interaction post-pandemic, and how can we build upon social cohesion in the years to come?
Well, in terms of children's social interaction, I do think that children, they learn faster and they adapt quicker than adults. So I do think that after this pandemic is over, they will be able to bounce back. I mean, children are naturally social creatures. They do, when they're in those situations, they're drawn to other children. They want to be interacting. They want to be active. So I know that this particular period is very challenging when a lot of children are isolated. But I think it's more about once we can get back to that normal situation, really working with teachers, working with families to making sure that we're setting up the environments that make it really easy for children to interact with each other, because environments can be so critically important, and yet they're often overlooked when it comes to behavior change.
So thank you so much. And another question coming through from the audience, Mohini, related to Valiku. Will you identify students who are chronically absent due to lack of digital access, and what can be done to determine if there are compounding factors? A student without digital access might be absent from school on that basis, but many also be unwell of facing family issues. So if you can try to cover that and the more broad digital question, that would be great.
Sure. Thank you, Inger. And just to add to what Andy and Alison said earlier, today's technology, current and new technology, has reached a point where even in the most remote of communities, you can bring relevant tech for interactions, whether it's between children and the community at large, teachers and families, and different parts of the ecosystem, to the point of identifying students who are chronically absent. This is precisely what Waliku does by digitizing a routine task of teachers. We have a data point at an individual child level that helps us aggregate for schools that information at a very individual hyperlocal level to say, these are the 5 kids in your school who are missing out a lot of schooling. And then for those class teachers to have that conversation with parents and with children to help remediate for it. And there could be several reasons for it. It could be, as the audience said, an issue around the challenges a family faces, and maybe these are children, particular children, girls or boys from a certain background who need that additional leg up assistance for social inclusion. So it's really using the data in the way that is most meaningful for the user and responsibly for that communication and for that improvement that we seek for schools and for children particularly.
Thank you, Mohini. I have one final question before our time is up, and that is for you from the audience. And will post-COVID-19 recovery usher or require an era of application technology on comprehensive healthcare based on digital patients data?
Well, it's already, yes. Well, it's already there. We know telehealth is there to stay. It's accelerated a lot of the work that's happening already. And in the sphere of digital health, and telehealth being one of it, governments, NGOs, civil society need a digital approach to their work with local communities to be effective. And children's personal data, health data, all of that needs to be used responsibly by those projects, organizations that are assisting communities in that improvement, and more so for groups like Waliku and other T4D solutions who have taken this responsibility to provide digital solutions, to work very closely with leaders in technology, in healthcare, civil society, communities, to see that is done properly. And so it is here to stay, and it's here to be at scale. It's how that journey pans out, we'll all see.
Thank you so much, Mohini. Thank you, Alison. Thank you, Andy. Thank you, everyone, for taking part in this this global launch of Save the Children's Global Center of Excellence for Innovation, and look forward to partnering with you in different shapes and forms. Thank you, everyone.